going to recite the correct. C is check orders and the patient's allergies. A is assess patient and assemble equipment and supplies. W is wash hands and don gloves. I is identify the patient using 2 identifiers and introduce myself. P is provide for privacy. And E is educate, evaluate, and explain. Okay, so I've identified my patient using 2 identifiers, name and date of birth. I'm going to explain that the doctor has ordered a catheter and that the catheter helps remove urine. Okay, I'm going to position the patient and provide perineal care before we get started, and ask the patient to use the restroom if they can. Okay. And make sure this is not opened or expired. Okay. To pinch this glove. And try my best. Okay, go inside the cuff of this glove. And then I can fix them. Okay. Next, I'm going to ask if the patient has an iodine allergy, and if they do, I would use the peroxide, but they don't have an iodine allergy, so I'm going to discard this, discard this. I'm going to open this and pour it on top of my cotton swabs. Discard. And then I'm going to loop my catheter. Okay, so this is how I'm going to loop it. We'll do that over here then. And then I'm going to remove this cap, attach it to the end of the catheter. And this is when I would check the catheter for patency and make sure it's working correctly if that's the facility's policy. And this one is working correctly. Then I'm going to take this hand, leave my dirty hand. Okay. Then I'm going to outside and go around so I don't contaminate. Outside. Inner. And down the middle. Okay. And then I'm going to insert the catheter 2 to 3 inches for a female until I see urine, and then about another inch. And tell the patient that this might be uncomfortable for a second. Okay, this mannequin is not to cooperate. Okay, that's as far as it's going to let me. But then I'm going to inflate. That would be on the inside. And make sure that this is anchored. Okay. And then I'm going to attach this to the leg using a strap or tape. And then I'm going to hook this onto a non-moving part of the bed. I would provide perinatal care again if necessary. And I would document patient response, attempts, what size French catheter I used, and how much water I instilled. That's it.